All right, so the COVID-19 outbreak is starting to affect everyday life right here in Western Massachusetts. As case numbers grow, officials are encouraging residents to practice social distancing, staying isolated in your home unless absolutely necessary. Joining us tonight in studio is Springfield Mayor Domenic Sarno and Springfield Commissioner of Health and Human Services Helen Caulton-Harris. First of all, thank you for being here tonight. We greatly appreciate it. Helen, we want to start with you tonight, though, on these social distancing protocols and precautions. What do residents need to know, not only right here in the city of Springfield, but of course all across Western Massachusetts?
Well, first of all, thank you very much for inviting us in to have this conversation. It is a very important conversation that we have with the residents of Western Massachusetts. Social distancing really is putting distance between you and individuals that you come in contact with. The CDC and the World Health Organization, as well as state DPH, says that that's from 3 to 6 feet. The number that you're hearing is 6 feet at this point. And so social distancing really means just taking the opportunity to distance yourself, to keep yourself safe and not spread what could potentially be a virus.
So, Mayor, what are the steps that the city is taking right now? Of course, we have St. Patrick's Day week beginning now. Obviously, the parade in Holyoke canceled. But, I mean, what are you taking precaution-wise here in the city of Springfield?
Nick, first of all, thanks for having us on and asking us to come on. First and foremost, I'm very proud of our city team. We've been tested and true. We've been through a number of natural and man-made disasters, and we've been able to come through with flying colors. And I want to reassure your viewing public, the residents of the city of Springfield, the business community, and Western Massachusetts. What we are looking to do here is to make sure that we close the schools as being abundantly precaution on that. We are opening up the school cafeterias. Outside food will be coming to the families that are in need on that. We have moved to shut down libraries and senior centers. Now, the vulnerable population seems to be of the senior age, and if you have health concerns or immune system type concerns. So that's extremely important, is vulnerability of that age group, and we want to cut the curve down. The other thing that is extremely important, though they might sound common sense and simple, this is coming from the experts about washing your hands, keeping your distance. If you don't feel well, stay home. We want to make sure that we don't face the same situations of my homeland, Italy and China. And these precautions that we're taking is to cut that number down. We've been in contact with Dr. Kerouac at Bay State Medical Center constantly. We want to make sure our hospital systems do not become overwhelmed. We're working very closely with them, and tomorrow at 10:15 we'll have another briefing. But the biggest thing is any leader, he or she, has to get out there to the public is that what has occurred, what hasn't occurred, what we're proactively doing about it, and we're going to get through this together and for the better if we follow all these precautionary measures that we need to do.
You are hosting a couple of meetings, several meetings this week with department heads. What is going to be discussed as we move forward, not only today, tomorrow, but in the next coming weeks?
I met with my cabinet heads, department heads, deputies, and lieutenants early Friday morning to list all the internal issues that we're putting across, internal procedures that we're going to be doing. Commissioner Helen Caulton-Harris has done yeoman work, well respected locally throughout the state and the nation. She's my point person. This is changing hourly. And I hope and I pray to God down the road, the next 2 weeks are very pivotal, that they'll say, hey, Mayor Sarno or Domenic, you were wrong. If we were wrong, that means we did our job and we made sure that we stemmed any tide. The containment is key here. So they know that their marching orders. We are still in city government, but we still need to provide services, but we have to make sure, I want to make sure my employees are protected from police to fire, all the way down to a rank and file.
Could I add a little bit with social isolation? I think social distancing, social isolation is also something we're concerned about for our elderly population. And we want to make sure that individuals are taking the opportunity to look out for elderly neighbors. And so social distancing is extremely important, but it's also important that we do look out for individuals who could be socially isolated during these times. Make sure that we are on the telephone calling individuals and also taking care of our children and their concerns.
And Helen, we're actually going to stick with you. What kinds of guidance are local health officials receiving from the State Department of Health and the CDC as well to really help you guys and, of course, the community in general?
The State Department of Public Health does webinars as well as we have telephone calls. So we are kept up to date in terms of just what the data is saying. There is also the MAVEN reporting system. In the Commonwealth, we have a system that does report infectious diseases. And each city and town, and you know there are 351 cities and towns in the Commonwealth, which each one has a health department and is part of the MAVEN system. So we are updated around the infections in our community, and we are also updated in terms of the data on a weekly, often daily basis.
Now, of course, this pandemic has caused the temporary closing for at least 2 weeks right now of MGM Springfield.
Yes.
Mayor, first of all, what would you say to that? And people who like to dine out and go out here in the city, are you prepared to take a financial hit?
You have to be prudent. Again, we said the circumstances where you should think twice. I've also declared a state of emergency. Why I did that technically, and as was a smart move with Governor Baker also doing that, that avails me to any and all resources from the federal and state level for any type of recovery and relief that is needed, whether to our residents and or to our business community. And we'll be working with the federal level through Congressman Neal, on the state level with Governor Baker and our legislature to make sure that we're able to go after any and all resources for those businesses that are affected. MGM, we've been in contact with MGM, and I've asked them with their food source that they have, that they'll be giving food sources to the open pantry, that stuff that has to go pretty quickly, the Friends of the Homeless, Bill Miller, the open pantries, Terry Maxey, and the Food Bank of Western Massachusetts, Andrew Morehouse, while that is closed. It's a difficult decision, but it's the right decision because, again, the governor has given the edict of 250 or less or more. You cannot gather together on it. I know it's difficult right now, but by making these moves, we do not want to face what has occurred in my beloved Italy or in China. And these next 2 weeks, Dr. Fauci is renowned, respected on both sides of the aisle. A lot of testing is occurring now. So you could possibly see that number jump. Now, as of this morning, Commissioner Helen Caulton-Harris has informed me we do not have, as of this morning, an active case here in Springfield. And I'm hopeful we can keep it that way. But we have to plan for the worst so we can be better off in the very near future.
And going off of that and what you said, Mayor, we do expect these case numbers to rise as we go by the days. And obviously, people are going to be maybe having some symptoms. And if they do have symptoms, what should people know? Where should they go? How should they get tested? What should people know and do, even if they think they may have some symptoms?
If individuals are sick and having symptoms, first of all, they should stay home.
Yes.
We are asking individuals to stay home and get in touch with their primary care physician and explain the symptoms that they have. We do not want individuals to rush to emergency rooms. One of the challenges we want to avoid is having our healthcare systems strained with individuals who could be treated by their primary care physician or at home. So if you're sick, stay home, call your primary care physician, explain your symptoms. You will be guided from there.
Schools are closing. Mayor, as you mentioned, MGM Springfield temporarily closed. Let's talk about the senior centers now.
Yes.
Some are temporarily closing as well. For those services, what should seniors know and do in the meantime as these facilities close as well?
Well, I think, as Commissioner Helen Caulton-Harris indicated, it's important that we make sure that we check on our family members, friends, and seniors and neighbors of that age, and make sure that any assistance that they might need. Why we're doing this, again, because that seems to be the vulnerable age, especially if you have health concerns. But that's the age, and also if you have some severe health concerns or your system is low as far as handling these type of situations, you should be cognizant of that, and you should really stay out of big crowds or stay home if you can. We are continuing to develop a plan for emergency response with police and fire and AMR if needed, and maybe even some outreach things. But right now, these simple and common sense things coming from the experts mean a lot. And if we can stay on top of this, we stay on top of this, as we've recovered through many other natural man-made disasters, we come back bigger, better, and stronger. Right now, we need to cue in on this, follow the procedures. Hopefully within the next 2 weeks or less, hopefully, let's see what happens. By following this, we cut the curve down and we start to continue to stabilize and move it down and get some more information where we can start to move forward.
And I think I'd like to just add to the mayor's comments that elders may need someone to go grocery shopping for them. So we want folks to think about what are those common sense things you can do for seniors who are going to be in their home to make their lives easier, and so they don't have to go out and interact with the public on a constant basis.
And of course, as mentioned as well, schools are closing. UMass Amherst just announced last week that they are going to be closed for students for the rest of the semester. Mayor, I'd like to go to you now. What resources are being made available for not only students, but for parents as well as we go through the next 2 weeks and beyond now?
We are now meeting, we'll be meeting with the daycare providers very early tomorrow morning to see what restrictions that can be allowed within reason to continue to help parents out at that point in time. Parents, on their own are going to have to be able to look some type of assistance now. That's why it was important for me to declare a state of emergency, because again, it avails myself to go after every dime I can get from the federal and state level to help our residents and our business community in a swift recovery on that. We're going to continue to develop a plan. I know there's been some United Ways on the other side, eastern part of the state, that are offering. There's many volunteer groups or agencies that, as they've done before, will step forward again. But right now, we're awaiting, again, continued guidance from the federal level. Governor Baker's been very good on the state level, but it's really been up to the frontline people, or the governors or mayors. We're frontline. We're on the street to start making these decisions. And again, I weigh this on the facts. We weigh this on the facts and the medical information that we are receiving. My duty and my responsibility is for the public health and safety of all the residents of the city of Springfield, the business community. And as I've done before, we'll make decisive action if needed. And we will get through this, Nick. We will get through this together and for the better as one.
I think you said it pretty well there, Mayor. Final question, I'll go to you both. A final message to the people of Western Massachusetts. Obviously, we are a few weeks in now, and this looks to continue at least for another couple of weeks. What would you tell the people of Western Massachusetts right now?
First of all, I would say that we understand that individuals are nervous and have fear. There is so much that is unknown with this virus. So we want to exercise our compassion and patience, and we understand individuals are concerned. The best thing you can do is the non-pharmaceutical interventions, and that is the things we've talked about, the hand washing, not just regular hand washing. Make sure you're washing those hands good. Social distancing we've talked about. We've also talked about staying home if you're sick, covering your mouth when you sneeze. And so those things are what we know works with bacteria and virus and infections. Please make sure you're doing that.
Mayor.
We're trying to be prudent here. We're taking this very seriously, but we're also trying to tamp down hysteria also. And that's extremely important. By taking these measures, and as I've done before, my administration has done before, we're going to let you know what has occurred, what hasn't occurred, what we're proactively doing about it, and just as important, that we will get through this together for the better as one. We've proven it with other disasters. In a way, Nick, when we got hit by that EF3 tornado, I knew what hit me. and I knew how to hit back. With the freak nor'easter, we knew what hit us, we knew how to hit back. That's why we have to take these precautions. This is almost like a ghost. It's ever evolving. Helen will tell you every hour we're getting updates, things are changing. But we want people to use common sense. We will get through this. Follow the measures. The next 2 weeks hopefully will be very telltale as we move forward.
All right, well, thank you both
Thank you.
for being here and obviously giving this vital information to the residents of Western Massachusetts and giving your perspective as well.